All right, welcome back, guys. This is Quentin Chambers with Alpha Allied Mental Health Services. Quentin, the NP, right? Psych NP. I'm going to talk with you guys for just a minute. It is December 28th. It is a Monday. We just got done with Christmas, all of that. We're in a pandemic, and so that means that weird stuff happens. Like I try to grow a beard, and let the gray show and things like that, and it's been an experience, right? Learning. I'm in my 40s, and to show the gray, is liberating, right? So, okay, that's enough of the disclosing about myself. But what I really want to talk to you guys about for just a moment would be the insurance, right? This is like really crucial, guys, because there's a lot at stake here that's coming up in the next year in 2021, and how that affects us as providers to provide care for you guys under your insurance, right? So what we did is we're taking a deep dive look at what does that mean for each of our patients? What does that mean if you're on Medicare? What does that mean if you're on Medicaid? What does that mean if you're a commercial patient, right? All of the rules are going to change quite a bit. We have to look at the marketplace to see exactly what is going to be allowed, what is going to be what they call bundled effect. That means that they're starting to do things like put all of our services in a wraparound one thing. You get one time to bill, and you better put everything in there, charge us for this much. The problem is that many times we're just not knowing exactly what does that bundle fee look like. So what ends up happening is it gets passed on to you guys, right? In some instances, we can't do that. We lose money. So we find out, here's what we can treat you with, here's what we can't. In my opinion, way too much control from the insurance companies, and so much less of it being an interaction between me and you. We want to find a way to stop some of those things. Some of it we can't prevent. All of us are used to using insurance. We feel like, you know what, I spend a lot of money on this insurance and I would like to use it because why would I pay out of pocket if I'm already paying insurance, right? Well, here comes the big issue that kind of scratched my head, and I thought, this doesn't make sense. And hopefully we can find out a way to deal with this, right? So what I discovered was I pay a premium, for insurance like lots of other people, right? Let's say, for example, you have an insurance that you pay, I don't know, if you're lucky, $1,000 a month, right? So you pay $1,000 a month to have the insurance. What does that mean? That means that you have the ability that when you go to the hospital or the ER and things like that, that they're going to say, yes, we'll let you in the door and treat you. In the emergency department, yes, they have to let you in whether you have insurance or not. However, a bill follows that, right? So that's called the catastrophic part of insurance. So that's what we hope for, is that it will handle those things. We get a broken leg, we, do a fall, we need surgery, we need treatment. God forbid we have the C word, cancer, or something bad, right? If that kind of stuff happens, that's what insurance is for, right? Well, we come to find out that even though we have insurance, it still doesn't cover a lot of that stuff. We have to go through what's called a deductible. The deductible says, yeah, we know you're paying $1,000 a month, but you have not paid off the $7,000, the $8,000, the $12,000 that you have to pay before we'll even think about trying to pay in money, right? How does that make sense? Doesn't make sense at all, for us to pay for premium insurance, pay a monthly fee, and then still have to pay, if we're lucky, $3,000 out of pocket before they start paying. And then it's 80% of what we are already paying for anyways. Then there's the copay, right? So the copay is oh, I'm paying a premium, but every time when you come and see a doctor in the office, it's likely you got what's called a copay, which is them saying you're paying your portion of the insurance for this visit. So that could be anywhere from $25 to $40, $50, right? Wow, it seems very, very unfair. It seems like it's just piling on and on and on. Then they add on the patient responsibility amount, right? So that's again part of that whole deductible thing, copay thing, is that they're saying we are not paying this whole 100% of this because this is the plan that you picked. So therefore, yeah, you got to pay in more money, right? So we are looking at that whole situation and saying, how do we help in this situation so that, number one, we as a practice can continue to treat people and not have the monetary issue be an issue, right? We certainly advise all patients to have insurance. Let me say that first. And so this is for informational purposes only. So come in, guys, let me tell you a little bit more about it, right? So essentially what we're saying is if you have the ability to get catastrophic insurance, do that. That will lower your monthly rate, right? Because honestly, you're probably not going to meet your deductible anyways. So even if you have a huge deductible, that means that in many cases at least, that things got to be pretty serious before they actually pay in anyways. So save yourself some money and basically get catastrophic insurance. Okay, so then what do I do next, Quentin? How do I see my provider in office? The best suggestion that I have for you is to call that office and say, hey, can we work out a plan where I pay you X amount of money per month? Whoa, wait a minute, Quentin. Wait. Why would I pay you guys money? I'm already paying them money, and now I got to pay for this deductible and this and that. Remember, you're probably going to go from that $1,000 down to $700, maybe even $600, depending on the plan that you use. So now you're lower in the cost that you're getting. And even when you come up and let's say you pay $70, $100 a month, you're still coming out. You're going to be better off. Do the math. Find out how much you've been spending per year and getting hardly nothing out of it, right? Meantime, you're still pushing money out. If you see your mental health provider once a month, even twice a month, there's still likely you're going to get better benefit from being on a payment plan that you pay X amount of money per month. You can see them as many times as you need to. That makes things better. That means that you are contributing to really the betterment of the practice for your mental health provider. So that's something to think about, guys. It's not for everybody, not going to be the situation. We understand there's going to be a lot of people that is thinking, I don't like that. I don't want to give any money out of pocket, right? Guys, you're already a cash pay patient. I'm sorry to tell you that, but that's the truth. I'm a cash pay patient. Most people are already, unless you're government insurance, it's likely that you're paying out of pocket first. And you're still thinking about it as though you're not doing that. But if you take a deeper look at what's going on, every time you're going into an office, every time you see them on telemedicine or talk to the doctor, you have that copay. You have that deductible that's coming up that you have to pay. And then they start paying. Some people won't reach it until this time next year. So what does that mean? All that time you're a cash pay patient and you're going to have to pay out of pocket. Now, think about this. Do you want to do the situation where you are deciding, you know what, I'm not going to see the provider that often because I can't afford that? Well, actually you can. You already can afford it because you're already paying in so much money for something that you cannot use. They made it very hard for you to use it. Okay, so that's my rant about that. The next part would be, I want you to think about out-of-network benefits. This is a good place to look at as well, guys. Let's say you get in a situation where there's no other providers around you. You don't like the provider that you have, that's not working out well, et cetera, but the other provider is not in your network, right? So, what do you do about that? use out-of-network benefits. I would call my insurance, find out what kind of out-of-network benefits do I have in terms of seeing a mental health provider, and then I would talk to the practice, my practice, Alpha Allied, because guess what? Here's what we'll do. We will we'll get a form from your insurance, fill it out, help you fill that out, and then send it to you so you can turn it in. Sometimes we may even fax it over there for you, and then we will allow for you to basically follow up on what happens after that. So what that does is you'll have to pay upfront the cost of coming for the visit. It is what it is, guys. Do the homework again, and I'm telling you, you're paying already, right? However, here's the sweet thing, is that now with the out-of-network benefits, you're either going to get all of that paid for, or most of it is going to be paid for by the insurance company once you do the pre-authorization, or they may call it pre-certification. So it's just a form that they're saying, yep, we recognize that this person is out of network and you have benefits that say we allow for that. Find out how many times a year, ask them for the maximum. Right out the bat, ask them for the maximum amount of units possible. So you can put like 12 to start, right? That means once a month you get seen, and it's all prior authorized until the person that you're seeing either gets with that network, or maybe they don't. At least you get covered for the year, okay? So that is something to think about. I realize, again, that's not for every person, but here's what's coming. Here's what the problem is. The problem is the providers themselves, we're getting pushed so far, we're not getting paid like we should be. It is taking longer to get paid for less. They're not paying for what they agree to contract amount is even for. I could go into all of the logistics of it, guys, throw some numbers at you and things like that. But what it comes down to is by the time we pay for one front desk staff, pay for our lights and utility bills and things like that, we're not, if we were to stick with a normal schedule of seeing patients, very, very hard for us to even come up with really truly coming out in a profit. And that's what we want to do as well. We want to be profitable as well. At least that's me. I want to do that. I'm going to be honest up front. I want to see patients, number one. I want to treat them, number one. But at the same time, I can't even do that if I don't have the right reimbursement to do those kind of things. Is that your problem? No, not really. The problem is the insurance companies have made it your problem, okay? So for that reason, it's better that we look at either those options, or you can flat out not even use your insurance altogether. Do a membership program, which we basically just charge a flat $70 per month. The first initial visit is $225, and then every single visit after that for infinity is $70, unless we see that economics and things like that creates where we have to move it up a little bit. But in general, we feel like we have a very, very good program, and you get all of the benefits. You see us as many times as you need. We offer that, you can text us, email us, patient portal, for about $125. You'll also get a therapist that will also be seen as many times as possible. And as you most around the country, it's about $75 to $125 per visit for a therapist to be seen. So some things to think about in terms of how we do things at Alpha Allied. Wanted to just kind of go through these things. I know this was a very long-winded visit with you guys, but I just wanted to go through those things with you guys. And again, I'm Quentin Chambers, the Psych NP with Alpha Allied Mental Health Services, and we'll see you next time.